Thanks to our session chairs and the SAGES Program Committee for this invitation. The many facets of surgical advocacy is what I was tasked to talk about. And I'll certainly go over the many facets of surgical advocacy, but I think the take-home point I want to drive home is that you just got to roll up your sleeves and get involved. Just dive in. And sometimes that's hard to do, and you may be doing it and not even knowing it currently. I have nothing to disclose. So we'll start with how all things start, Google. So if you Google advocacy, this is what you'll find. Public support for or recommendation of a particular cause or policy. And I think it's important to note it does not always require political action. Although, here's the rub, anytime you have allocation of human and or financial capital, that will require some policy making, and if there's policy making, then there is political action. But let's start with something that we can all kind of relate to. Most of us are fellows of the American College of Surgeons, and it's important to note that the very first core principle of the Code of Professional Conduct is to serve as effective advocates of our patients' needs. And this is something that we do quite willingly and quite well, and don't even have any second thought to it, and does not have any political basis. So I think it's important to keep in the core that we are all effective advocates, and we need to just expand that definition of advocacy. So timely enough, when I was preparing for this talk, the ACS bulletin for August last month was all about advocacy, health policy, and the ACS has really been the most mature and robust advocacy program for surgeons over the many years, and a lot of the other organizations are also now getting involved. But it has many opportunities for all levels of interest, and in fact, many of these committees or programs that the ACS offers actually have SAGES member involvement currently. And so you can easily, pick one and see if any of your SAGES friends are on there to kind of get you an easy liaison into the world of advocacy and health policy. Of note, I'd like to point out the Leadership and Advocacy Summit. It's something that I did very early on when I got involved with advocacy, and kind of just gives you a immersion into the field, and you meet colleagues from not just general surgery, but from neurosurgery, ENT, all of our surgical colleagues. And it's held every spring in Washington, and it's kind of a good way to get involved with the process. This is another actually good guide. It's pretty short. It's only like 25 pages. Very large print, many pictures. So you can read through it, and kind of gives you an overall view. I have a QR code. I know everyone's sick of QR codes after checking in, but it's a good, easy guide to read, and gives you a structural overview of how the ACS looks at advocacy. But I think in general, it's a good way to kind of framework how you may want to enter and what level you want to enter into advocacy. As I mentioned earlier, there are many organizations involved, and a lot of times we were kind of doing it individually, and I think it's much better as surgeons to have a collective voice and all row in the same direction. And so a few years ago, the Surgical Care Coalition was formed with the 13, I would say, larger surgical societies, and I think it's a very good site or outlet for information of what's going on currently, and just to kind of keep your eyes focused, because things change, landscapes change, the fundings change, and everything is in flux. And the Surgical Care Coalition kind of tries to point what's most relevant for surgeons and what we need to advocate for. So this slide, I kind of just wanted to mention the many facets of surgical advocacy in broad terms. And I think there are indeed many facets. First and foremost, we have to be there for our patients. And, this can mean just promoting equal access, supporting the fight against surprise billing, quality measures, and just general education. Technology, as surgeons, we embrace technology, and I think the session that we just had is kind of reflective of that. And as SAGES members, we are at the forefront of developing, adopting, and onboarding new technology that enables us to deliver better care. But we have to champion not just the research and development. We have to champion the other part of it, which is the reimbursement of that technology and how we can bring this technology to our patients and have payers pay for it. So that is kind of part and parcel with the advocacy of technology. And we do a very good job of one, but not so much on the other side. Obviously, we have to support education and mentorship, as well as funding for the next generation, things like expanding residency slots. These are the things that we're tasked with as current surgeons for the future. Professionally, obviously, our work matters. Surgical care doesn't only enhance lives, but saves lives and is greatly appreciated by our patients. But we need to remind our institutions and our states and the federal government of this constantly. For example, care provided by other advanced healthcare professionals does not dilute our value. And I think we need to advocate for that and remind people of that. And finally, I think one of the things that I've noticed at this meeting is we finally come to realize that we need to advocate for ourselves, and not just our physical health, but also our mental health, as was highlighted by the pandemic. We talk about OR ergonomics. So we need to advocate for how we work and how we live so that we can do all the things that we are trying to accomplish. This is an interesting kind of call for action that I saw from a past president of the American College of Cardiology. And I know a lot of times people think it's just not the right time for me to get involved with advocacy. And this was back in 2017, and I think it holds true for 2021, and will likely hold for 2022, 2023, and so on and so forth. And that's that advocacy can seem daunting. Understanding the complex political process on Capitol Hill and the State House is difficult and can be intimidating. And in our current partisan and divisive environment, it may be tempting to avoid all interactions with our political processes in favor of avoiding conflicts in the workplace, among friends, and even at home. So, again, you don't need to go to Capitol Hill. I think you can start locally. That's the easiest way to get involved. Get involved at your own institution with committees and project improvement projects, or performance improvement projects. Remember, the essence of advocacy is just collaborating with multiple stakeholders for a common goal. And so I think those are the things you can kind of foster even at your own institution. Any educational endeavor that enhances student or resident experience is always going to be relevant. So, advocating for simulation for surgical residents is something that you can do as well. Initiated grand rounds on advocacy to kind of get more people just involved or know about what advocacy means. One of the things that we had in our institution that became very took on like wildfire is that the EMR system was we have Epic, and it's very data entry, primary care based, and does not have a lot of surgical or specialist favorability because we're not data entry people. And so the fatigue of multiple clicks to get something done was really weighing heavily. And so we really advocated for specialists to become super users to help the institution navigate that. Remember, as physicians and even surgeons, you are very highly respected in the community. And so reach out to your local officials. They will be very receptive to your thoughts and ideas. And so you should try to use that as one avenue of enabling change. And finally, success in advocacy is more about anecdotal wins and less about the scientific evidence. So you got to really learn to take the small wins and move on. And these are some of the recent surgical advocacy victories that I could kind of get a list of that crosses all those various things that I was talking about with patients and ourselves and our profession and education. So stopping the 9% payment cuts across the surgical specialties for the 21 fee schedule, compromise on surgical billing that prohibits more than the in-network charges will be starting in 2022, creation of new residency slots and help for staffing of rural hospitals and physician shortage areas. So, these are all education for our profession, for patients. All of the many facets are covered in those. And some of the other ones are listed for the most recent things that we've done, like increased access for colonoscopy, funding for firearms, the COVID-19 Provider Relief Fund, and funding for cancer research and prevention and clinical trials. I think the most important thing to remember is these may be either temporary or they will be limited or something else will come along. And so advocacy is kind of this never-ending cycle, but getting involved, rolling up your sleeves and getting involved is the key. Thank you.